community health worker is basically someone that is trusted by the group that they work with and has a lot in common with them, kind of is able to identify with them and knows where they're coming from so that you can hook them up with needed services that will impact their health in a positive way. The role for community health workers is just coming into being, and there's an under-realization of all the roles that they could fill. The idea was to embed a community health worker right in the clinic so that we weren't just referring people to agencies around town, but that I would be right here to work with them directly. Typical things you might see that come to the surface are a patient isn't taking a medication because they can't afford it. A lot of times what I find when I really sit down and start visiting with people is there's much more to the picture than that. You know, maybe they're having trouble getting to the pharmacy to pick things up. You really need to be knowledgeable about all of the community resources that we have available to people.
I have been working at the Asian Center since 2009, and I started working as community health worker in July. At the Asian Center, we serve over 1,000 per year. As a community health worker, I educate them you should have a physical checkup to preventive care. They should know about diabetes. If they already have a diabetes, they should know how to control their blood sugar. When I know they would like to see a doctor, but they don't have insurance, I know some resources. I will refer them to People Health Center.
There's so many different terms, so many different titles for community health workers that some might be using navigator, another might be using health educator.
There are too many people with different names who help the community, and they don't call themselves community health workers, but really they are community health workers.
A lot of times people tend to think of the term as someone that works with a traditional minority group, speaks another second language other than English, but every group has needs to be linked up with services.
Key things are listening skills, the ability to advocate on behalf of an individual, helping them to give voice to the things that they need in the community.
We learn about them, about their lives. I know her, so I know I have to be very patient with her, and I have to be sure that she uses her insulin.
I think it's important as a community health worker to really be a part of the healthcare team, integrate in with the doctors and the nurses. One of the things our clinic has is a diabetic educator, so we work closely together. I think that really helps maximize what we can offer and increase the quality of care for that person.
I think community health workers are very important for the communities because we are the bridge or the key to find out more about the community or the client, what is in the hospital or doctor's clinic.
I think to be a good community health worker, it isn't really about a degree or formal training as much as it's about your communication skills. A lot of that is listening skills.
Many Vietnamese people, they come here after I help them, they say, oh, we're very lucky to have an Asian Center here. If we don't have her, we don't have Asian Center in Lincoln, we don't know where we can come for help.
I think that's really the essence of a community health worker, is taking the people and connecting them up to all the resources that are in our community.
It's a huge piece for individuals who haven't had a voice in our community in the past and now do have a voice.
My name is Maria, and I am a community health worker.
My name is Pai Pai. I'm the interpreter and the community health worker.
My name is Mariana, and I'm a community health worker and a health coach.
My name is Ha. I am a community health worker.
My name is Dion, and I'm a community health worker.